this is Dee, and right now Dee presents today with some signs of aging around her eyes. She also has a little bit of loss of fullness around the cheeks, and some early lines right around the creases of the mouth, leading down in this way as well. And one of the things that we've been talking about is an upper blepharoplasty, and an important aspect of deciding what to do in regard to an upper blepharoplasty is the position of the eyebrows. And she has very pretty eyebrows in a nice high position, but she does have a significant amount of skin redundancy in the upper eyelids, enough that this upper eyelid skin almost rests upon her lashes. So what we do in an upper blepharoplasty is make an incision right where the natural crease line is. And if you see the difference between the right and the left eyes, taking and elevating this upper eyelid skin allows you to see the upper eyelid again, whereas this upper eyelid skin on this side is so significantly lax that it obscures most of her natural upper eyelid. So what an upper blepharoplasty would do would be to make an incision right along this crease line. If you open your eyes just for a second, and you see everybody has a natural crease there. Go ahead and relax a little bit. And this incision here would be made up in this area, and then the amount of redundant tissue is also demarcated, and so that the amount of skin to be removed is what's between my pointer here. And the incision that would be seen after surgery would be an incision right into the crease, extending out to about right here. And all of this redundant tissue would be removed. The fat injection would deal with a different type of aging, in which she's lost some of the volume of her cheeks. The fatty tissue normally goes away with age. And so what we do is we take fat, transfer it from the abdomen and into the middle aspect of the cheek so that we can recreate the apple of the cheek that she used to have when she was young. And that makes a significant difference. You can see by recreating this fullness, it lifts up on a little bit of the crease here and gives you more of a softer look. The fat injection can also be applied to the hollowing out underneath the cheekbone here too to soften this appearance. And we all have loss of fat in our cheeks as we age, and that's both in the deep tissue as well as the superficial, and the fat transfer mostly replaces the more superficial fat loss. Fat injections can also be done into the crease here to soften this area and give a more uniform demarcation between the fullness of the cheek and the upper lip. It can be done into the lips, into the downward tilt of the mouth here as well, and it also gives you a very soft, natural look.